So when I'm looking at someone's face, we start looking at the upper eyelid skin. And you can see there's over that fold there, as we age, that skin will start becoming excess and folding over. And when we do that, that makes the patient an excellent candidate for an upper lid blepharoplasty. What we do there is we make an incision, close your eyes for me, right where the skin folds over itself, completely hidden in this crease and a little past the corner of the eye. And through that incision, you can open your eyes, we can remove the excess skin. Once we remove that excess skin, we'll see the second layer that's just underneath the skin, and that's these muscle layers here. And you can see here we have drawn out the muscle called the orbicularis oculi muscle that goes all the way around the eye. It acts like a purse string to close the eye. And then there's the frontalis muscle here in the forehead and the corrugator muscles here. And once we remove the skin, we'll see this red muscle underneath. And a lot of surgeons will then trim that muscle to take away a little bit of excess. You can close your eyes right through that area too to show more eyelid. But I do not like doing that because it can cause more hollowness. Even though it shows more eyelid, it can look more aged when you do that. And it can have functional problems down the road. So we really avoid removing that excess muscle. Underneath the muscle are fats. This is the third layer. And you can see on the upper eyelid, there's a pocket of fat here that sometimes bulges. There's a pocket of fat here that sometimes bulges. And there are 3 pockets of fat on the lower eyelid. And then on the outside corner, there's this gland here, the lacrimal gland, that makes tears for our eyes. So we want to make sure we leave that alone. And we really want to leave that fat in that third layer alone on an upper blepharoplasty as well, because we don't want to hollow out your eyes. But for some people, this nasal fat pad, the one very close to the nose, does bulge over time. And that fat is independent of the fat on the rest of your body. So whether you gain weight, whether you lose weight, it's not going anywhere. So oftentimes we'll make a little hole inside the muscle so that we can get to that little pocket of fat, and we tease out a little bit very conservatively and trim it out, and that fat bulge will go away. Now, oftentimes there'll be a lot of excess skin on the outside of the eyelid here. And patients will think, oh, we can just take the incision all the way out to the side to get more skin. But that can have 2 negative effects. One, if you take the incision too far out, it can make a longer, more visible scar, which we don't want. And 2, if you take out too much skin, it can start pulling the eyebrow tail down. So we have to combat that by adding support. Generally, we need to do something called a temple lift, where we make an incision behind the hairline and lift that brow up to support the brow so it doesn't get drawn down, and also so that it can unravel the skin so we don't have to make the incision too far out past the corner of the eye. So that's why a temporal lift is often very much married to an upper lid blepharoplasty.